Hi, so yes, my name is Ashley Hutton, and my clinical experiences so far as it is in the field, I am actually already doing primary under supervision for clients, not all clients, but at least a portion of them since last semester. So throughout the summer, I've been taking on that role, and it's been really helpful in helping me connect what I'm learning academically with the real world, what it's like to deal with an actual client myself. And it's helped me to kind of see what I do know, and it's helped me to learn that I am learning more than I thought I was. Because it's hard to know how much you know when you have someone else that is saying all the things and doing all the things, and you're like, yeah, absolutely. But when you have to have that recall of whatever it is that you're trying to address with the client on your own, that's a whole other story. And it's been helpful for me to kind of get a little more confidence actually in my abilities as a midwife in the spot that I'm at so far in my learning. I actually was able to even sort of practice a manual placenta removal, which no, you don't ever want to have to do that, but as far as the learning and everything is concerned, I was able to do it. And this was with, it's a whole story I won't get into, but it was on the student side of things kind of neat to be able to do. Definitely not for the client, and I would not wish that for anybody. But and I've also learned that I need to do more digging when I am talking to a client, asking more questions, more clarifying questions. It's not been anything major, but it's been a critique that I've noticed that I would give myself. Let's see, what skills do I have down cold? Well, the basic stuff like vitals, I have it written out here. Vitals, taking health history and health education, communicating in a way that is clear and direct, taking labs, any of the labs, blood labs, urine, any of that, being able to identify what fetal position the baby is in, their growth, their heart rate, finding it on a Doppler or on a fetoscope. Fetoscope I'm still kind of working on a little bit for the earlier ones, but as they get older, it gets a lot easier. Individualized care, charting, cord cutting and clamping at the appropriate time, APGARs, initial newborn assessment, a lot of postpartum stuff. I feel pretty confident in. And the ones that I've always wondered why my preceptor puts developing for my HIPAA compliance, like ability to have the HIPAA compliance. And I don't know, I keep forgetting to ask her why she says that, because I feel like I've got that one down. And then things like physical exams, abdominal assessments, like fetal position in labor. I think that is mostly because it's not something that we do as much in reality, at least not with this preceptor anyways. So she hasn't really had a chance to see me do those things, but I feel like I would be able to have at least a competent grade on those skills. And the last bit of that, I think I agree with her with the things that she does have me as competent at. I feel like, yeah, I do agree with it. So I don't know that I would say, anything there. And then the third question, what skills have I not achieved competency with, and how can I practice them? Well, I mean, there's the ones that I'd mentioned before, and obviously taking and ordering PAPs and other cervitology microscope skills. Pelvimetry, I need more practice with that for sure. And hand maneuvers, I know them, but I need to learn a little bit more about like the pressure that you need to put on, whatever area. And nuchal cord I can usually get, but like, for example, we just had a birth where this I was able to assess, yes, there's a cord there, but it was too tight for me to be able to just loop over the head. And so we did the somersault, and I needed her to help me with that because I had seen videos that said something about bringing it to the birthing person's thigh, but my preceptor was like, just go towards their butt basically, and they'll somersault out of that. So I need to just kind of look into that a little bit more. Birth registration, I just have, I do all the paperwork and everything with them, and I can tell them how to do that, but actually plugging it into the online system, I've just never done that before. So those are things that I would like to definitely work on. How can I practice them? Well, I think by, using models and working with students. And we actually talked about, there's another student that I think would be willing to like do a PAP on me, and then I do a PAP on her. That would be great. The microscope skills, I would have to look into that. I did at one point have a plan to go to, volunteer at Planned Parenthood, but I just don't have the time to be able to do that and my clinical stuff and my schooling at the same time and be able to manage that in a way that doesn't make me go insane. So I'll have to figure out more about that. Let's see here. Commonly practiced in your clinical placement. Yes. Okay. I think my professionalism is pretty good. I feel confident in that. The one thing that I saw when I was reading about that was the works collaboratively with other healthcare professionals. I have done that, but like with other midwives, I've done that for sure. I also do birth assisting with other midwives too. And they've come and like helped out with other births, like breech births and multiple births and stuff like that. And I'm able to work with them well. It's more the getting to know the other health professionals in my area that I would be working with, aside from midwives, and just building that professional relationship with them, which I think would just be something that I would have to work on over time as I have, transports or other reasons to collaborate with these people. But I am able to like send requisitions and stuff like that for clients for like ultrasounds for whatever reason that we may be needing those. And I have been able to call the hospital and alert them about a transport that we're doing and providing appropriate paperwork. So it's not that I'm wholly unable to do that. It's just an area that I think I could fine tune a little bit better by building relationships with them. My plan to prepare for the integrated assessment skills exam. So my plan is right now I have a standing appointment with a couple other MCU students where we have an hour or two that we will spend studying together, working on skills and working on written exam questions and things like that. So every Friday at 4:30 is what I have with that. And then I have another student that is local here that I would like that I mentioned earlier, that they're also excited about practicing the skills and stuff like that together with me. And I would also like to have just at least an hour or two a week to do my own studying on my own. And, the whole questions thing I think is a good idea. Coming up with questions and answers is wrong as well as right, so that I can kind of get into the groove with that, and just practicing skills on my own as well. And I'd like to have some time to kind of talk through some of those things with my preceptor. I just talked to her yesterday about, particularly like the skills scenarios or the case scenarios, those questions and the process that, I would be taking to do whatever skills that I would be demonstrating there as well would be helpful. That's my plan as of now. I'm sure it will evolve as time goes on. And then the optional skill modules that I'll need is pretty much all of them. I'm going to need the Pap test and microscopy, the episiotomy, and local anesthesia. I feel like I know the anesthesia and I know the episiotomy is just something that I haven't been able to actually practice in real life. So that's why my preceptor does not have me just yet at the competence level. The Pap test and I definitely need to work on that. And moving forward into phase 3, how ready am I to move forward? I mean, once I get these skills down, because I feel like I'm already kind of there. I am already practicing the phase 3 type of stuff. So, in clinic at least. And I haven't totally messed anything up yet. So I feel pretty good about moving forward. I just want to get, obviously these skills to a competent level where my preceptor also agrees and can see it. And a lot of that is kind of time. And we are working on getting our an office back together so that we're not having to drive so much. We have clinic 5 days a week and we're driving at least 50% of the time, and it eats up a lot of the day, and it's really hard to keep up with that and everything else and then have time to really go through things like we'd like to. So our hope is that once we have this office up and ready to go, which should be in the next week or so, that we will have a lot more time to be able to do those sorts of things. And that's what I'm looking for to move forward. I want to be able to have a little more time to get things to that competent level and get my confidence on those areas up. And I'm ready to move forward.